In today's topic at Medical Sciences, we are going to discuss with you primary hemostasis, which is part of hemostasis, that is coagulation. So hemostasis, it is a Greek word. As we introduce primary hemostasis, before we begin it, the word hemostasis is we can divide it into two words. Hemo, which means blood, then stasis means stopping. So hemostasis is the stopping of the blood flow after the injury. So if this is the blood vessel and an injury occurs on the blood vessel, the process by which the blood is stopped from oozing out of the blood vessel, or what we call bleeding, is what we call hemostasis. So hemostasis, in summary, is the stopping of blood flow or stopping of bleeding after the injury to the blood vessels. So that is what we can call hemostasis, is stopping of bleeding, especially after the injury. After injury to blood vessels. So that is what we call hemostasis. And hemostasis is categorized into, there are many processes which occur under hemostasis, whereby we have vasoconstriction. There is vasoconstriction, followed by primary hemostasis. Then lastly, we look at, then there is secondary hemostasis. Secondary hemostasis. Then after secondary, we normally regard it as coagulation cascades. This is coagulation cascade. Then lastly, we have fibrinolysis. So these are the steps under hemostasis as a topic, whereby we look at vasoconstriction of the blood vessels after the injury, leading to primary hemostasis, and the end result of primary hemostasis is platelet plug formation. Platelet plug formation. So primary hemostasis aims at forming a platelet plug, but this platelet plug formed is loose. It needs a wire mesh. It needs a mesh formed by the coagulation so that we stabilize the platelet plug at the injured site to stop blood from oozing out. So, and this hemostasis, as we shall see on it, that is coagulation, it has what we call the intrinsic pathway and the extrinsic pathway, then plus the common pathway, as we shall see in the coming video. So that is secondary hemostasis, whereby we are looking at the action of clotting factors. Then fibrinolysis is the process by which, after forming a fibrin mesh, this is the breakdown. We shall look at how we break down a fibrin mesh. After stopping bleeding, this fibrin mesh should be cleared from the circulation or from the injured site, and it is by the process known as fibrinolysis. So in the coming videos, we shall also discuss with you secondary hemostasis and also fibrinolysis. Those are the ones we shall also discuss about. So in our today's video, we are focusing only on primary hemostasis plus a small thing on the vasoconstriction. And the primary hemostasis, which we are going to look at, primary hemostasis, we are going to see events that occur after injury. Events that occur after injury leading to formation of a platelet plug which stops blood from oozing out. And before primary hemostasis, we have seen there is vasoconstriction of the blood vessel, that when there is an injury, when an injury occurs on the blood vessel, like at this point, this injury is going to destroy the endothelium. This is the endothelium of the blood vessel. So after the injury has occurred, there is exposure of the subendothelium. Subendothelium is exposed. And after exposing the subendothelium, we are going to see the subendothelium contains proteins like collagen. It contains collagen. This is collagen, is a protein. And when an injury occurs, we shall expose collagen. And this collagen, it is always together with von Willebrand factor. So this one we are going to call it von Willebrand factor. Von Willebrand. Von Willebrand factor. So when an injury occurs on the blood vessel, there is damage of the endothelium leading to the exposure of the subendothelium. And when the subendothelium is exposed, there is collagen and von Willebrand factor which are present. And these are the ones that are responsible for platelet adhesion. And we shall see, we are going to discuss primary hemostasis under the following headings, whereby primary hemostasis is going to occur, whereby step number 1 is platelet adhesion. Then the second one, we shall look at platelet activation and release. Then we shall also look at number 3, which is platelet aggregation. Then number 4 shall be platelet fusion. So these are the processes that occur under primary hemostasis, which we are discussing, and the aim result is platelet plug formation to stop blood from oozing out. So we are seeing that when there is an injury to the blood vessel, the first thing to occur is platelet adhesion. After vasoconstriction, when an injury occurs like this, the first thing is vasoconstriction. And this vasoconstriction is triggered by the endothelium. And this subendothelium, there is a component known as endothelium. So the endothelium is the one that triggers vasoconstriction of the blood vessel. Why is the vasoconstriction happening first? Is to reduce the amount of blood coming at the injured site. And after vasoconstriction, and we have exposed the collagen and von Willebrand factor, the platelets which are present, they are going to start moving towards the injured site. And when they move towards the injured site, by chemotaxis, they are going to come and attach. So these platelets, they have a receptor. And this receptor is known as, they have a receptor known as glycoprotein 1B. And this glycoprotein 1B is the receptor that are found on the platelets. So when they move towards the injured site, they expose their glycoprotein 1B on their surfaces, which they use to attach on the von Willebrand factor. So when platelets reach at the injured site, we are seeing they are going to adhere to the von Willebrand using, so platelets having the glycoprotein 1B as their receptor, they use them to bind to the von Willebrand factor. And when they bind to the von Willebrand factor, they become activated. They fuse, they bind, and this is what we are calling platelet adhesion. So more are going to come and start adhering. If we have more von Willebrand factor at the injured site, another von Willebrand factor maybe is here in the presence of collagen. Another platelet comes, you're going to see another platelet coming. And this platelet is going to expose its glycoprotein 1b and adhere to the von Willebrand. So this is also von Willebrand factor. And when the platelets begin adhering to the von Willebrand using glycoprotein 1b, this one leads to change in shape. So platelets adhere to the injured site using glycoprotein receptors, glycoprotein 1b receptors, which are on their surfaces, hence binding to the von Willebrand factor together with the collagen. So when they bind, this is what we are calling platelet adhering. So many platelets are recruited and they adhere to the injured site. And after adhering to the injured site, it is going to lead us to the second step, which is platelet activation. And what is the platelet activation? If I have a von Willebrand factor, this is the von Willebrand factor, and this is the platelet, and the platelet has adhered using glycoprotein 1b. This is the platelet. So after this adhesion, this platelet will change shape. It will trigger change in shape. Change in shape. We know that the normal shape of platelets are they are disc-like in shape, but they are going to change to form, they change their shape to form pseudopod-like shape. They form the pseudopods. So you find the platelet which is attaching on the von Willebrand, which was discoid in shape, it changes shape and forms a amoeboid shape, or what we are calling pseudopods. And this is what we call platelet activation. And during changing in the shape of the platelets, they are triggered to release granules. So after changing in shape within the platelets, we have granules. So change in shape leads to the release of platelet granules. And these platelet granules released, we have ADP and thromboxane A2. These are the granules that are released after the platelet being activated. And platelet activation is only change in shape from discoid shape to the pseudopod shape or to the amoeboid shape. And as it is changing the shape, it is triggered to release granules, that is ADP and thromboxane A2, as we are going to see their role in platelet aggregation. So we are saying when they bind these platelets, they change the shape. The platelets change the shape from discoid to amoeboid, and after changing shape, they are triggered to release substances. And the substances which are released, we are seeing ADP, adenosine diphosphate, and another one is thromboxane A2, which are the platelet granules released. And the role of ADP, it is going to cause, it comes back and causes more platelets. So ADP, after being released, it is responsible for recruitment. ADP does a great role in recruitment of more platelets. So ADP, apart from doing a great work in aggregation, immediately when it is released after the platelets have changed the shape, it goes back and recruits more platelets to the injured site, because we have to come and recruit more platelets at the injured site so that we can stop blood from oozing out after the injury. So one of the laws, after activating the platelet into the amoeboid shape, releases ADP, and ADP goes and recruits many platelets at the injured site. And this role of recruiting is done by ADP together with thrombin. Thrombin also plays a role. Thrombin is always found on the endothelial lining of the blood vessel. So at the side of the injured site, we have also another coagulation factor known as thrombin. And this thrombin together with ADP, they cause more recruitment of platelets. And that is what we can talk about under step number 2, that is platelet activation and release. And this release of platelets is enabled by the contractions of the calcium ions within the open canalicular system. So the next step we are going to is platelet aggregation. And I want to zoom it this side. I'm going to zoom it here. We assume this is at the injured site here, but because it is already occluded, let me use it here. That after producing ADP and thromboxane A2, this ADP, apart from causing recruitment of many platelets at the injured site, it is also going to attach on its receptors. It has its receptors called PY2 receptors. So after attaching on these receptors, this ADP is going to cause these platelets to expose their receptors on the surface. And these platelets, they have receptors on their surface, and these receptors are known as glycoprotein. They have their receptors, and these receptors, we are calling them glycoprotein 2B/3A. These are the receptors found on the surface of platelets, which are triggered by ADP, and thromboxane. So this is also glycoprotein 2B/3A. So when they are exposed in the presence of fibrinogen, so in the presence of fibrinogen is always present. So in the presence of fibrinogen, these fibrinogen are going to enable adherence. They are going to enable platelets to aggregate at the injured site. I said that this one, I'm zooming it from here to here, but is occurring at the injured site. So what happens that in the presence of fibrinogen and glycoprotein 2B/3A, they are going to make, if this is platelet 1, this is platelet 2, 3, and 4, so they are able to adhere to each other to form a platelet plug. And what is triggering this aggregation of platelets together is ADP and thromboxane A2, which we are abbreviating as TXA2. So these are the guys that are responsible for platelet aggregation by causing the expression of the glycoprotein 2B/3A receptors on the surface of platelets, hence binding to each other with using fibrinogen, in the presence of fibrinogen. So this is also another fibrinogen. So the major role played after this ADP triggering and thromboxane triggering the exposure of glycoprotein 2B/3A, they are going to be used. So we are saying these two bring about exposure of glycoprotein 2B/3A, and this one's in the presence of fibrinogen. They are the one that enable formation of a platelet plug. So platelet plug is formed by the action of glycoprotein 2B/3A together with the fibrinogen, and where we have seen fibrinogen in the middle is the one that enables attachment of one platelet to the other using glycoprotein 2B/3A and fibrinogen. So many platelets are able to aggregate together to form what we are calling a platelet plug. So this is the platelet plug formed. So this is the platelet plug formed at the injured site, and is going to stop blood from oozing out of the injured site. So after seeing that, apart from thromboxane being a platelet, triggering platelet aggregation, thromboxane is also a strong vasoconstrictor. This one can also cause vasoconstriction. So apart from, there are two roles of thromboxane, that is platelet aggregation and vasoconstriction. And there are also two roles of ADP, that is platelet recruitment and platelet aggregation. You must master that. So lastly, when the platelets aggregate at the injured site using fibrinogen and in the presence of glycoprotein 2B/3A, the last step is platelet fusion, whereby these platelets are going to fuse in the presence of fibrinogen, whereby they start fusing together to close the gaps in between. So they fuse together to form a complete platelet plug. So the role of platelet fusion is to form a complete platelet plug, which is able to stop temporarily, to stop blood from oozing out of the injured site. So fusion is a last step whereby the platelets come together, they come closer by the help of a small mesh created by the fibrinogen, hence enabling blood from oozing out. So these are the steps we can talk about under primary hemostasis, whereby we have seen that it starts with the platelet adhesion due to injury that when the endothelium of the blood vessel is injured, it exposes von Willebrand factor together with the collagen. And von Willebrand factor together with the collagen, the platelets, when they reach at the injured site, they expose glycoprotein 1b, which they use to bind on the von Willebrand. And here that is what we call platelet adhesion. And when the platelets adhere, they become activated by changing shape from discoid to the amoeboid shape. And as they change the shape, they are triggered to release ADP and thromboxane A2, which are platelet granules. And once released, ADP is going to cause more recruitment of platelets at the injured site. And after recruiting more platelets, the ADP and thromboxane A2, they go ahead to trigger the platelets to expose glycoprotein 2B/3A, which binds in the presence of fibrinogen to join two platelets together. And when they join two platelets, that's what we are calling platelet aggregation. And that one occurs in the presence of ADP or triggered by ADP and thromboxane A2, leading to exposure of this glycoprotein, hence forming a platelet plug, which is strengthened by platelet fusion by recruiting more platelets and also making more blood red cells to come, hence making it firm to stop blood from oozing out. So we have to master the function of each. And after you have mastered the function of each, in summary, I can put them here. In summary, we have said during primary hemostasis, which is platelet plug formation, we have seen that collagen and von Willebrand factor in conjunction with the glycoprotein 1b, which is found on the surface of platelets, they are the one responsible for platelet adhesion. That is what we have seen. And number two, we have seen that after adhering, they change in shape, and the change in shape is what we are calling activation. And this activation causes release of ADP and thromboxane A2. We have seen ADP does two roles, that is recruitment of more platelets and also triggering platelet aggregation. Then thromboxane is responsible also for platelet aggregation, together with also being a stronger vasoconstrictor. So these are the two roles of thromboxane A2. Then we have also seen fibrinogen together with the glycoprotein 2b/3a that enables formation of a platelet plug after interacting together to form a platelet plug. So the platelet plug is formed whereby the glycoproteins 2b/3a binds the fibrinogen in between. Where we saw if we have a platelet 1 and another platelet, the ADP and thromboxane A2 causes exposure of the glycoprotein, and these glycoproteins are able to bind in the presence of fibrinogen. And this one we called fibrinogen. This was platelet 1, platelet 2. This is what we called platelet aggregation, and we ended with platelet fusion. So this is what we can discuss with. We can end with disorders. In case someone is lacking von Willebrand factor. So deficiency of von Willebrand factor leads to von Willebrand disease. So there are people who are deficient of von Willebrand factor. So meaning platelets cannot adhere to the injured site, so they suffer from bleeding. And those ones, they have von Willebrand disease. Then also there are those who are born without glycoprotein 1b on the receptors of the platelets, and these ones suffer from a disease, and disease is known as Bernard-Soria syndrome. Bernard-Soria syndrome. So Bernard-Soria syndrome, which we can call BSS, is due to the deficiency of glycoprotein 1b. So if you are born without the genes responsible for forming glycoprotein 1b on the surface of platelets, you suffer from Bernard-Soria syndrome. Then lastly, if you are deficient of this glycoprotein 2b/3a, you suffer from a condition known as Glanzmann thrombasthenia. So Glanzmann's thrombasthenia is the deficiency of glycoprotein 2b/3a, Bernard-Soria syndrome, deficiency of glycoprotein 1b, and von Willebrand disease due to deficiency of von Willebrand factor. And people who have problems of bleeding, we always give aspirin, and aspirin is responsible for inhibiting synthesis of thromboxane A2 by inhibiting COX-1, but majorly COX-2. So they do that by inhibiting cyclooxygenase, which is responsible for converting arachidonic acid to thromboxane A2. So aspirin acts by inhibiting synthesis of thromboxane A2 as a drug, which we use in people with problems of bleeding. So thank you so much for learning with us at Medical Sciences. This is what we can discuss under platelet primary hemostasis, which is the formation of platelet plug. In another video, we shall look at secondary hemostasis, and then we shall end with fibrinogen. And don't forget that thromboxane is a vasoconstrictor. Another one which is a vasoconstrictor is serotonin. Serotonin is also a vasoconstrictor. But how can we inhibit this process from taking place? The inhibitors of primary hemostasis include nitric oxide, together with prostacyclin. So prostacyclin and nitric oxide, these guys are strong vasodilators. They cause vasodilation. And vasodilation is one way of inhibiting platelet plug formation, whereby the blood vessels increase the diameter of the lumen, hence it is hard to stop blood from oozing out. So the inhibitors, we have nitric oxide and prostacyclin as the inhibitors of primary hemostasis. Thank you so much. May God bless you.